Hello, my name is Leslie Hughes and I'm the president of Boquete Health and Hospice. Boquete Health and Hospice is an organization that's dedicated to helping those in our community with various health-related issues. We have 3 branches in our tree. The first branch is dedicated to helping those in our service area who may have physical challenges that require the loan of equipment for the short term. The second is health and hospice services. Prior to the COVID-19 pandemic, BHH provided respite care for the caregivers of those whose loved ones require 24-hour care, in addition to light housekeeping and running errands. We can also provide meals for those who cannot cook for themselves, but only for a couple of weeks, and friendship baskets for those who are recently bereaved. At the far end of this branch, we provide support services for those nearing the end of life. The third branch of our tree is education. Boquete Health and Hospice is committed to helping educate the community in a variety of subjects, 3 of which are CPR, being prepared for death, and first aid. The magic of music is a bridge between the second and third branch. A couple of years ago, it was suggested that a music program be launched that would provide music for those who are bedridden or who were suffering from mental illnesses such as dementia or Alzheimer's. One of our volunteers has an extensive collection of music, and the team was willing to create personalized playlists for any patient that requested the service. However, due to the prevalence of music on the internet, this service never quite got off the ground. A few months ago, however, the team started to reimagine how they could provide a different service to the community. Instead of dealing with health issues post-illness, what if they tried to prevent or mitigate health issues through music earlier in the process? The team met, researched, learned, and experimented with playlists that included music that would increase health and wellness, help reduce or alleviate stress and depression, increase happiness, help with end-of-life issues, or just exercise the brain. I myself have tried using the playlists and have found that the type of music I listen to can affect my mood, or my concentration, or my outlook, depending on which category of music I choose. Our website, boquetehealth.org, has added several pages that can help explain how music can aid in wellness. It has a variety of playlists that will help with different wants and needs, and explains how all the research supports these ideas. Val Strahl has been involved with the Magic of Music team since the very beginning, and with the aid of the team members has brought a very new and exciting concept to Boquete. Val, would you please take over and give a more detailed explanation of what the magic of music is and how it can impact our lives?
Thank you, Leslie. I'm honored to be serving as co-team leader along with Beverly Stearns. When I was living in the U.S., I worked for a different hospice organization, and there I made music playlists for their patients. They were enrolled in the musicandmemory.org program. And now here in Boquete, we have our own music library, and we've got some equipment that we can lend to our patients. We've also expanded our programs to help the entire community. We've got some wonderful volunteers. I'd like to introduce to you Sandy Dillon. Sandy works with our patients and the caregivers to determine which music might help you best.
It's been a really interesting and great privilege, interesting time to be part of this team because everyone is working for the same goal, to make sure that the patients and caregivers that we approach with this whole idea of the magic of music understand exactly why and how we hope to advance with this program to the point where they begin to depend on us here in Boquete. And since I am one of the first persons that will be on that committee to see people, being able to speak to them in English and Spanish, because I do speak both languages. I'm hoping to do the best job that I can to make sure that everybody that I get to meet understands very well just how potent this program really is. it can literally change people's lives. I've had firsthand experience also being able to see the effect it has on someone who's in pain or someone who's stressed and upset because they are maybe at the end of their life, or just someone who's in this position of having dementia or Alzheimer's and being unsure of people around them. Music is amazing. It is very magical because it changes their whole outlook. And if you think about it for yourself, I mean, you think about going to sleep to music or being able to relax before something that you know is coming at you and you're going to be tense. But music will smooth it all out. So I'm really anxious to get going on this program and see how everything goes. Of course, there's a lot of support. These team members are fantastic. A lot of musicians and people that are really much more talented than I am. My talent is probably talking. So for now, I hope to meet the right people for the right position with the right music very soon.
Thank you, Sandy. Chuck High is also on our team. Chuck will tell you about his role.
Hi, I'm Chuck. I have the privilege of trying to help out here. I'm a retired occupational therapist, which meant that sometimes I would use music when I was working with children or with adults with neurological handicaps. Other times I didn't, but I like the fact that we're looking at providing services for the folks here and looking at the ways that music can help with relaxing or calming or helping to make life better for our patients here. I've had a chance to use music a couple times when I'd sing to people. One time it happened with my own mother. The last time I saw her, she had Alzheimer's. And the fortunate thing was I had remembered that her father had been a railroad worker. And so I started singing, "I've Been Working on the Railroad" to her. And for that brief instant of time, she started singing with me, and I had returned her to that room. And so we were in the same place at the same time. It was a really valuable experience for me. Anyway, before for this organization, I've helped with durable medical equipment and helped with training in terms of dealing with handicapped individuals, their physical needs. But for this, I'm looking forward to helping Art with research and looking at the ways that music stimulates different parts of the brain, which helps make up for problems you may have, or helps in terms of making you available to other people in your environment. So anyway, Val, that's what I think I'm going to be doing here, okay? Anyway, thank you very much.
Thank you, Chuck. Recently, we were looking to expand our team. Art Blevins, a local musician, wanted to join our team, and he had lots of ideas for us. Art has an interest in the wellness aspects of music. Art, why don't you tell us about your ideas?
I'm Art Blevins. I am a musician, and I have experience working here in Boquete at a local addiction rehabilitation facility, leading meditative mindfulness music sessions, which focus on holistic health and wellness. So I have experienced firsthand with recovering addicts how music can be utilized to improve one's physical, emotional, and mental state of well-being. I also spent a few years in academia as a college professor and have published original research in peer-reviewed international scientific journals related to human cognition. And this background facilitates digging deep into the scientific research that backs up music's impact on our health and wellness. As a musician, when I pick up an instrument to play, I frequently experience music's ability to transform my own state of well-being. I can feel the magic happening. But digging into the scientific research on music wellness pulls back the magic curtain and reveals exactly why music works in this capacity. And it also helps pinpoint the various characteristics of music that impact the human body, mind, and spirit so profoundly. Of course, most people are familiar with music as entertainment, but most are not familiar with using music for wellness purposes. My role on this team involves research, writing, communicating, as well as planning and promoting what the team is discovering about scientifically proven benefits of using music to improve health and well-being. Wellness is the act of practicing healthy habits on a daily basis to attain better physical and mental health outcomes so that instead of just surviving, you are thriving. As more and more medical studies reveal music's impact on the brain, music is emerging as an effective wellness practice. The team recently published on the Boquete Health and Hospice website a playlist guide which contains links to over 100 music playlists that can be used for wellness purposes. And we also published an accompanying explanation document which briefly summarizes the research behind music wellness. This document also offers suggestions based on that research to help individuals tailor their music listening experience to take advantage of these wellness benefits. These wellness benefits include reducing stress and anxiety, improving one's mood, improving the quality of sleep, boosting workout and exercise performance. So head on over to the Boquete Health and Hospice website and check out the music wellness playlists for yourself.
I can hear music. You like it? Yes, I do. Repeat louder.